back to the channel and moving on to the episode 7 of the Guide to Orthopedic. In today's episode, I'll share the experience on fasting blood sugar. So what happened is I was in my first year residency and anesthetists, they used to give advice on the fasting blood sugar of the patients, and you usually ask the sister, you ask them to you write in your notes, as well as you ask them, okay, please do this in the morning 6 o'clock, because we have to send the patient 7 o'clock in the OT. Okay, and in that period of time, basically a lot of things happens, like changing of the clothes of the patient, and then we send the patient to the OT. These things take a lot of time, and in that period also the sister has to do the fasting blood sugar now, and it's a R1 duty to check those fasting blood sugar and to ask the sister what is the fasting blood sugar of the patient, and then they have to inform to the senior as well. A lot of time what will happen, because of a lot of things happening around you, like dressing, okay, like dressing, like plaster application, like preparation for the patient, all of things are happening around you, and you just forget that one information of fasting blood sugar, or sometimes the sister forget also to do that, and she also forget to tell you that that's a fasting blood sugar. Now what happens is that when the patient goes into the OT, okay, you are there in the ward till 8:30, and then 8:30 you leave the ward and you go to the OT. You prepare for like a servant, you have to prepare for the table, you have to like assemble all the things, and so you and your colleagues will be doing the assembly things and assembling the servants as well. You will be doing all that, but during that period what is happening is during that period the anesthetist is doing his work. He's checking the PAC, pre-anesthetic checkup advices, what they ask for, how much you have provided, how much whatever the reports they have asked for, have you attached the reports or not, whatever the blood investigation, the reports, if you have attached them properly, then there will be no issue. But one thing we usually miss, that is the fasting blood sugar. So that fasting blood sugar, you will think, hey, what's the issue in that? We can do that in the OT also. It's not about doing in the OT, it's not about the time, how much time it take, but it's the anesthetist that will just he will not just tell you, he will not just ask you about the report. What he will do, he will wait till 9 o'clock. 9 o'clock is the time when you shift the patient inside the OT. Till that he will wait, he will inform and wait, and as your senior come to the OT, then to your senior he will ask, इसका तो FBS का report attach ही नहीं है. Then what will happen? You all the residents are inside the OT. Now one of you will change, and then you will run towards the ward, and depending on at how much distance it is in the ward and how much distance is there in between your ward and OT. So depending upon that, you will run, you'll go back, you print the FBS report and you bring it back. Now sometimes what will happen, you don't have a report. Because of that, the patient OT can be cancelled, even because of that. It has cancelled. Otherwise, most of the time, it will get delayed. And that delay of like 15 to 20 minutes, though in that period, what will happen to your colleagues, like the guy who is going to the ward getting the reports, but what will happen to your colleague? गालियाँ जितनी भी आती होगी वो सब दे रहा होगा, झाड़ रहा होगा, मतलब पूरा बजा रखी होगी उसके कलीग्स की, तुम्हारी सबकी बजा के रखेगा हो. बिकॉज इसकी वजह से क्या होगा, द होल प्रोसेस गॉट डिलेड, एंड प्रोसेस गॉट डिलेड मीन्स now it is the responsibility of the third year to inform the AP before the OT, this patient has been taken inside the OT, and it is at 9 o'clock when the third year informs the consultant. And if the patient got delayed, and the consultant will ask the third year why, then he has to tell the reason. If being an R1, you think कि क्यों बताया उसने, वो छुपा भी सकता था, इसमें बड़ी बात क्या है, कुछ और रीज़न बताया था. But remember, these things छुपती नहीं है. तुम्हारा कंसल्टेंट आएगा तो वो वहाँ पे जो एनेस्थेटिस्ट है सबसे पूछ लेगा, एंड कोई ना कोई बोल देगा, आजू बाजू में 25-50 लोग खड़े हैं, किसी के मुंह से तो निकलेगा ही। और इतनी चुगलियाँ होती है ना मेडिकल कॉलेज में, इतनी चुगलियाँ होती है ना, पूछो मत, हद से ज़्यादा। सो ये FPS का इम्पोर्टेंस कितना है। और ये ऐसा है कि ये अभी यहाँ पीछे छोड़ देगा, ऐसा नहीं है। जब तुम बोर्ड में जाओगे, OT खत्म हो जाएगा, तुमको लगता है कि हाँ और बाकी सब पूरा दिन अच्छा गया, OT अच्छी गई, बट तुमको लगता सब ओके हो गया, बट नहीं, यहाँ कुछ ख़त्म नहीं हुआ है। तुम घर जाओ, वार्ड में जाओगे जब, तब वहाँ पे क्या होगा, वो सिर्फ वो तुम्हारी तब भी बजाएगा ही, ठीक है। बहुत कम होते जो नहीं बजाते, बट वो वहाँ भी तुम्हारी बजाएगा ही, डेफिनेटली बजाएगा। यहाँ ख़त्म नहीं होगा, तुमको पनिशमेंट मिलेगी एक्स्ट्रा वो। और तो FBS का स्पेशली ध्यान रखना है। सुबह 6 बजे उठ के पहला काम क्या करना है, FBS रिपोर्ट सबकी चेक करनी है, उसको अटैच करना है। डोंट फॉरगेट दैट, ओके। एंड दिस इज़ अ पर्सनल एक्सपीरियंस आई हैव शेयर्ड। बहुत बार हुआ है, भूल जाते थे, नहीं होता था, ठीक है। बट पूरा दिन बच जाएगा तुम्हारा, पूरे दिन का जो मूड है ना वो अच्छा हो जाएगा अगर ये रहा तो, ठीक है ना। चलो।